Hello, my name is Dr. Teresa, and welcome to your lecture. In this lecture, we're going to cover the psychological dimension of health. When we talk about psychology, I'm going to be delivering potentially a fresh perspective on some things. Please know I do not have a degree in psychology, but I do have a mind. And as a human, we experience different thoughts and emotions, and then from those spaces, we take corresponding action or have a particular behavior that is associated with thoughts or emotions. So let's dive in. So first of all, I feel like oftentimes when we're discussing health, that we do not understand the intimate intertwining that our mental emotional state has on our physiological health and well-being, or our physicality. We have to recognize that just like kidneys, heart, and joint, the mind has its physical foundations within physics and chemistry and biology. So in this lecture, I'd like to maybe flip your perception around thinking about your thoughts and emotion from a more biochemical state. I'll try to do a little bit of linking into cellular mechanics and the biochemistry inherently within that. I feel that in an attempt to understand our health, we have found a lot of value in approaching human health from a very mechanistic and reductionistic philosophy and approach to our health and well-being. But I also feel that in order to be able to understand and obtain a true state of well-being, that it's best to merge that mechanistic approach with a more broad spectrum and holistic approach in regards to assessment as well as treatment modalities, so that we have the best of both worlds. We can look at the intricacies and the mechanism of the mystery, but also we understand the vital life force in any dimension of health and how it relates to other parts of our health and well-being. So let me ask you some questions for you to sit with as we go through the lecture. When we're talking about our mental emotional state, do you think that either directly or indirectly that your emotions can be or are connected to physical pain in your body or physical and or physiological dysfunction? And then I'll ask you why or why you don't think that. So let's just toe dip into the lake of psychology. When we talk about psychology, we're talking about the observation and measurement of the mind. More redundant questions. Where is the mind located? Have you thought about what thoughts are? Have you thought about the depth of what an emotion is? Have you thought about how your thoughts and emotions impact your behavior as well as your overall well-being? And how do the body and the mind impact one another? So the definition of psychology, or the definition of the mind, from the APA Dictionary of Psychology, is an intellectual and psychological phenomena of an organism encompassing motivational, affective, behavioral, perceptual, and cognitive systems. That is, the organized totality of an organism's mental and psychical processes and the structural and functional cognitive components on which they depend. So when we talk about the mind really is like this coordination point of thoughts, emotions, and actions. It's kind of like the dispatch center, where there's a receiving, there's an interpretation, and then a correspondent action, thought, word, behavior, something that comes from the integration of information. The physical and anatomical relay station of the mind is the neuroendocrine system. What that is saying is that your nervous system, brain, spine, nerves, and neurotransmitters, along with your endocrine organs and all of your hormones, are this anatomical and physiological melting pot point where we do the integration of a stimulus, interpret it, and then have a reaction or response. I would also stretch and say that the mind anatomically really is everywhere, but also kind of nowhere. Let's break down then the difference between thoughts and emotions, or feelings and thoughts. An emotion is that feeling. It's the sense. It gives us this interaction with reality of kind of five sensing something. So let me give you an example. You have an experience or you come in contact with something like chocolate, and you like chocolate. So chocolate delivers you within your body maybe a sense of peace or well-being or joy when you get chocolate. So when we have an experience like that, that will inherently also have associated with it certain chemicals in your body, primarily hormones, but some neurotransmitters as well. These chemicals are your body's responders, stimulators, and messengers of conscious things you're aware of, and unconscious stimuli or experiences, or things you're not really focused on. For example, sunshine on your skin is doing chemical things. It's real, it's present, but maybe like you're not really thinking about it. Now, when the sun is not there, you might have a different sensation, feeling, or emotion within your body. Different hormones will be inspired or in deficit. Interestingly, when we have these feelings, these sensations within our body, they can be fueled by the internal environment or the external environment. So we might have a hormone cascade triggered within us because we had coffee. That's going to give us maybe a feeling. Maybe we will feel anxious. Maybe we will feel on edge. This can also come from something outside of us, like someone's words, right? Either they're encouraging words and they come to us and they will inspire, again, a cascade of responses within us that really have their foundations in our physiology, that give us a feeling of happiness or joy. And the same could be true from someone that is coming at you with negativity or an attack. I feel that when we are able to fully process these chemicals within our body, this helps us have clearer thoughts and respond and act differently. So again, let me ask the question, which I've already asked. If we have, well, I kind of asked this. If we have emotional pain, is it separate from structural pain? If you're understanding what I'm saying, that the biochemistry of your feeling is tangible, it's physical, it has a chemical to it, then we can say that emotional pain can manifest physically. For example, if you are experiencing grief because maybe you lost a pet or you lost a loved one, and you know that deep feeling of sadness and you can feel hurt in your body, it is uncomfortable. This has its foundations within your biochemistry, within those hormones and neurotransmitters. So if we don't learn to process these chemicals appropriately and we have these feelings, we might take a premature action or have a premature behavior because we haven't developed a way to make sure we practice the pause, make sure that our behavior isn't coming from a space of wounding, but really rather observing our emotions from a mature standpoint and learning when to act and or respond when our internal emotional space is fueled with something other than something inspiring and helpful and positive. Now, when we talk about the mental dimension, this is our cognitive space, our thoughts. This is, we could put intellect in here. This is our ability to reason. Again, not quite the same as an emotion, but really they're fueled by one another. You can have a good thought, which will give you a good emotion. You could have a bad thought, which will make you feel like garbage. And the reverse is true as well. Now, have you ever actually thought about what a thought is constructed of? Really, it's nothing, it's air, right? Until you take action from an inspired thought or from any thought. Okay, this could be bad or good. Again, this is potentially founding behaviors and actions and or words. So having a mental dimension of health that is healthy so that we're not jumping into reactive behaviors that are founded on negative thoughts, wounding, and past traumas. If we have a toolbox full of ways where we can observe, assess, and transform a negative thought prior to acting on it, this is a good idea. Let me give you an example. If you have in your mind someone upsets you, so now you have a negative emotion, so you're angry, right? And you have like negative thoughts about, maybe you want to hurt them or punch them or something. That to act from that space to project out onto someone or something like that is probably not the best idea. However, if you have a thought that's positive and inspired, like maybe you have an idea for a great invention that would be helpful to you or those around you, that is a thought. When you actually go into an action space from that inspired thinking, that is a totally different product, right? What we have to be careful with our thoughts is the fact that they are extremely malleable and they're programmable, meaning this: if you don't have a strong mind that is fueled by your own internal authenticity, you can very easily be hijacked by someone else's truth. So when I talk about programmable thoughts, it will be inherently valuable to learn yourself and your inner landscape extremely well so that you take every piece of information that comes to you through your filters of discernment. When you do that, then you can more appropriately choose the thoughts of other people and institutions that you allow inside of you if they are not actually in resonance with the truth of who you are on the inside. So I think it's really important as information comes to you that you are discerning, again, with what any information that's coming to you. And when I'm talking about programming, oftentimes institutions are really great at understanding the weakness of the mind. This is why, like, advertising during the Super Bowl is a great thing, right? There's a lot of psychology that goes into such things. Now, when we're talking psychology, I want to talk about some of the disorders that we might see within this or these dimensions of health. These could be mood disorders. This could be schizophrenia. This could be personality disorders, impulse disorders, and dissociative disorders. Now, the slides coming up may not be in this exact order, but we'll walk through some of them and talk about some of them. So depression, anxiety, these would be mood disorders, bipolar disorder. When we have depression, clinical depression, everyone, please understand that having ups and downs and lows and highs in and of itself, that is not an abnormal human experience. It is when the ups and the downs really we're not able to contain or control them, and they impact our behaviors in ways that might not be healthy and well ultimately. So depression. Depression, I feel, is one of the hardest things to work with. Depression is hopelessness. So hopelessness for whatever reason. You can't see your way through the mud of whatever you're going through in any one time. Depression can be very serious because when a person reaches a low point where they have no goals, dreams, desires, there's no point for them, that is when we get things like addictions and suicide. So depression, I feel like, is one of the ones that is, and it's just really hard to help someone out of their own pit of despair, because when humans are that depressed and that low, there's like no connection to good, positive, or light things. Even if they're present, they can't see through their lenses at the positive things. It's like, it's a snowballing effect that throws you into like a pit of despair, and there's no rope. You can't climb out. It's so difficult. So depression can be treated with talk therapy. I think that's really great. Some of the medications that can be utilized for depression, we'll see things like Elavil, Tofranil, Anafranil, and Pamelar, Zoloft, Celexa, Paxil, and Prozac. Serotonin and norepinephrine reuptake inhibitors will include Effexor, Cymbalta, and Dalcipran. Now, when we have depression, this is where we go into the biochemistry of it. I do not have a slide on this, but let me touch on this. Serotonin is the neurotransmitter that is responsible for keeping us out of depression. When there is ample amount of serotonin produced in the body, we tend to be less depressed. There are many factors involved in serotonin production, but 95% of all of the serotonin in your body is produced within the lining of your intestines. If you have the intestinal disrepair, we will see it likely manifest as serotonin. Now, there are other reasons why serotonin may not be being produced effectively, or whatever. Maybe there was a trauma to the nervous system, like the brain. Maybe you had a brain injury. That doesn't have to mean like you got hit on the head. Emotional traumas can create brain damage, and I use that term very loosely. But when we go through something where the biochemistry gets a little bit deranged, there can be things you can do to help yourself. And I want to say at the end of the PowerPoint, we're going to talk through some simple ways to help manage depression. When we get depressed, again, everyone experiences lows. Everyone will experience situations within their life where they're just feeling like they need to retreat into their own little void and space. And I think that needs to be tempered with appropriateness. So each person will be a little bit different. Seasonal affective disorder. This is a type of depression. This is a very real thing for those of us that live in the parts of the world where there is not a lot of sunlight, or it is very selective sunlight. This is a real thing. Sunlight is responsible for vitamin D, which is classified as a pre-hormone, but other things in the body as well. So in order for all of that to work and the hormones to be produced that we need to make our brains do what our brains do, okay, part of it, not all of it, can be related to SAD or seasonal affective disorder. Some things that can be done for this would be, medications to help through the winter months or the dark, cold times, but also any type of light therapy, really, really great simple fixes. Also, I would say that for seasonal affective disorder, morning sunlight directly on your face and your skin is like really powerful. It sets the tone for hormones throughout the day and helps with circadian rhythms. But it's just, when the sun is available, get the sun. Now, the anxiety disorders. These are multiple as well. Generalized anxiety disorder, or GAD, is characterized by a patient or person not being able to state that which they're afraid of. Also, for GAD to be present, generally it has to be a chronic thing. Yes, once again, we all have situations where we have some anxiety or fear or panic just throughout life, ups and downs. This would be extreme nervous system dysregulation. So for 6 months or more, where there is a fear of the future. And I think that's a relevant thing to discuss as well. Oftentimes depression is like sadness over the past. Like you can't quit mulling over mistakes or perceived mistakes and people, places, and things, and injuries and wounds and trauma. Whereas anxiety, we're kind of afraid that maybe a traumatic experience has produced a fear of the unknown because it makes us feel unsafe or unstable. Symptoms of anxiety are excessive worry, uncontrollable anxiety or panic. You might have palpitations, insomnia, irritability, and then you get brain fog, like super brain fog. Treatment for GAD is medication generally, and then some type of talk therapy. For anxiety disorders, personal opinion, I feel that anxiety disorders are a little bit easier to have an effective toolbox to help manage us when we are in high anxiety states, or so that we can regulate our nervous system appropriately. Post-traumatic stress disorder is one of the anxiety disorders where there's fear, preoccupation with memories and dreams and the trauma. And you can have some sound or smell or something that trips a person into a state of panic where their whole body perceives a threat, even if it's not real. Like they're running from an imaginary tiger that's not in present time. It was from a past experience that their body just almost goes into autopilot, needing to fight the tiger or run from the tiger, or, fight, flight, fawn, or freeze type of responses. This too can be treated with meds, psychotherapy. A lot is helpful with family education. So when a person is in the throes of PTSD stuff, the family can be aware of the symptoms and what they're doing. Cognitive behavioral therapy can be helpful, as well as social interventions, maybe, limiting high stimulus situations would be helpful. Panic disorders are also classified under anxiety disorder. For panic disorders, this is where the palpitations and the tachycardia comes in. So you can have anxiety and a panic disorder beside one another. Also, by the way, anxiety disorders most of the time are not like alone. Most people with anxiety also experience depression. They're very rarely like all by itself. So other things we might see in this category: phobias. These are irrational, specific, and anxiety provoking fears, like, hydrophobia, fear of water, claustrophobia, the fear of small spaces. Social phobia involves a generalized fear of being embarrassed in a social situation. Also, some other things we can put into this category, maybe like an obsessive compulsive disorder, because the obsession is really founded in the fear. Because the fear is so large, the obsession comes to be put in place in order to help abate the fear or the manifestation of bad things happening again. Psychosomatic disorders in relation to any of these things, this is your mind making things happen in your body. This is the connection point or a connection point. So or an example of the connection point. So it's a psychological cause creating a physiological response, like tension headaches, muscle spasms and tightness, clenching your jaw, or irritable bowel syndrome. There is a giant contributing factor to IBS and stress, right? Mental, emotional things. Also, another example of us being able to quantify really our emotions when we take blood pressure. Sometimes when we're overly stressed, if we go to a doctor and they take our blood pressure and it's high, but generally it's not high, that is a psychosomatic response that we can quantify and give a number to. When we talk about bipolar disorder, this used to be known as manic depression. It's really like super extreme states of mania and then depression. Again, dysregulated nervous system, usually due to some type of damage or trauma, if you're looking back, and a feeling of shame, regret, guilt. That would be the depression part, and then a ton of fear and anxiety and potentially PTSD coming in there. And all of these other things can be encapsulated under these umbrellas. So the mania, when that comes in, that is overexcitement. It is that super high dysregulated state. And when someone is in their manic portion of this, they are impulsive, hyperactive, they can't sleep, rapid, disjointed speech and thoughts. You can treat bipolar with some medications. And it depends where you're at and who the person is, and the extremes and the history, of course, will be super relevant to determine what kind of medication will be best. So cognitive therapy, again, family education, group education, put together with the medication can be super helpful. Electroshock therapy. Okay, this is a real thing, and I guess they still do it. That is last resort, trying to get the regulation in the brain. Now, when we talk schizophrenia it's not a split personality, it's a hallucination. It is thinking there's a lot of paranoia, difficulty concentrating, maybe jumbled sensory perceptions that aren't consistent with their thoughts. They're seeing something that they really perceive is like constructed of the material of their reality. Like if they see a person, they think they can touch the person's, clothes, or they think they're part of their real world, but no one else can see them in that construction. So usually they have to be put on an antipsychotic medication to stop the presence of the hallucinations. When we talk about personality disorders, this is a little bit different. Borderline personality disorder, or BPD, will describe a person who is impulsive, manipulative, and unstable. They will have behaviors that will include promiscuity and potentially self-mutilation, so cutting maybe. Narcissistic personality disorder is diagnosed in a person who has an exaggerated sense of self, controlling, bullying, that's narcissistic behavior. Now, NPD, okay, is an actual, diagnosis. Now, there will be tendencies along the spectrum of personality disorders. I think that's clear too. There's probably most of us that have witnessed or, done ourselves, or like you think you might have some of these behaviors, and you don't have the true diagnosis, but we as humans may have experienced somewhere on a spectrum, in some way, shape, or form, some of these disorders. Antisocial personality disorder is synonymous with the term sociopath or psychopath. These people will lie, cheat, avoid responsibility, and lack guilt or anxiety about their behavior. When we talk about sociopath and psychopath, these are non-empathic people. They are really disconnected with their feelings, and they don't have the guilt or remorse or that self-observation and reflection. The only way, I guess, they think they are bad or wrong is because there's a moral construct around it where they would get in trouble, or, by the rules or laws governed by society. People with paranoid and schizoid personality disorders tend to be self-absorbed. They lack trust and are fearful of intimacy. When we have dissociative disorders, you can have dissociative amnesia, and this is a term used when a person cannot recall his or her identity. A dissociative identity that was multiple personality disorder. Both disorders are characterized by a dissociation of past experiences and present identity. So it would be like an amnesia of who you were. And they've done some research on people with dissociative disorders. And when they're in one personality, they have absolute physical symptoms that they can observe and measure. And then when they come out of that personality, they're gone, or there are new ones. They've done x-rays of a person with rib fracture in one identity and the absence of the rib fracture in the other identity within minutes. So it's fascinating and interesting, I guess. And I say within that experiment or within that study within minutes. I don't know the exact timeline. However, when we're talking about there's a lot of these personality disorders that really come from trauma or abuse, and are ways that person has found to regulate their nervous system. Not necessarily appropriately, but it was likely a survival technique. And I don't speak in a broad blanket term there. I'm saying that in many of those cases, there's a contribution. When we talk about impulse control disorders, these are explosive behaviors that may encapsulate unrestrained aggression toward people or objects. So kleptomania, the irresistible urge to steal. Trichotillomania, the compulsion to pull out one's own hair. Pyromania, the fascination with fires. Substance abuse is a continued use of drugs despite significant substance-related problems. So that would be an impulse control disorder. So if the person is, in liver failure and they can't stop drinking or won't, that would be impulse control. So some therapeutic procedures, supportive therapy, this would be talk therapy. Psychoanalysis encourages a patient to say whatever comes to their mind so they can truly be observed and watched. Psychodynamic psychotherapy is similar to psychoanalysis and focuses on identifying unconscious patterns in current thoughts. Cognitive therapy, this will help people identify distortions when they're attempting to interpret an experience. I think that's really relevant. And there are a lot of counselors and therapists out there that do a cognitive style of therapy to help a person that has had repeated traumas be able to view reality or their world, like clean up their lenses of perception, sort of, to help them see better outcomes of situations that maybe within the past or through the trauma or through an abuse, they came out with something different. Behavioral therapy, this is similar to cognitive therapy. It believes that abnormal behaviors are due to faulty learning. Interpersonal therapy, this is a treatment for depression and will focus on unresolved grief and conflicts. So here are some ideas. I had mentioned this previously. Some natural integrative therapies for some mood disorders like depression and anxiety. Some ideas for depression. And a person would have to know their situation, have some testing done, run these ideas through their practitioner, make sure nothing is a contraindication to any medication that they're taking. But for depression, things like 5-HTP, which is a precursor to tryptophan, or you could eat tryptophan containing foods. That would be turkey. Magnesium, vitamin D, probiotics, and B vitamins. That's going to be the same, really, the probiotics, the B vitamins, and the magnesium for anxiety as well, interestingly. Some foods that can help, bananas, high healthy fats, green leafy vegetables, and potentially peanuts or peanut butter. I think that for depression also, journaling is great. Talk therapy needs to happen. And brainwave entrainment or brainwave music is wonderful therapy if you have low levels of this stuff. Also for any type of disorder or trauma or abuse, there's something called EMDR therapy, which I think is really functional. You can go have a clinician do this, but also walking in nature serves almost the same function neurobiologically. So it does the same kind of thing in your brain and syncs your hemispheres and helps you almost, this is like a processing method of trauma or abuse or pain or whatever happened. Now, when we talk through an anxiety disorder, again, this is a high state of neurologic dysregulation that can be helped through a couple things. Grounding, meaning go walk in the dirt with your bare feet. Go be in nature. Nature has an amazing way of regulating the nervous system and regulating your brain. So whether you're walking for depression or walking for anxiety, the outcome is going to be regulating the nervous system. Breath work. Interestingly, most of us don't breathe really, really well. So we breathe very shallowly. If with anxiety, if we know that we are safe in our body, and breathing being one of those things that will help this and make us be in our present time, by the way, grounding will do the same thing. So we're not worried or focused on something that hasn't happened yet and may not happen. Breath work can help a lot. Ice work. Ice work is something that I stumbled upon and I think it's fabulous. This could be taking an ice cube to the back of your neck while having a panic attack or an anxiety attack, or this could be the regular incorporation of like a cold shower or a cooler bath cool temperatures, again, making you're in your body, you're in present time, and it does help regulate the nervous system tone. It's really interesting how quickly that can work. I would encourage here theta brainwave music. It takes you into a meditative state. It's a little dreamy, a little drift off state. It's that state kind of between wake and sleep that you can bounce in and out of. If you do theta brainwave work, make sure you're thinking positive thoughts or things that you want to create. That's a great way to put things into focus, into alignment. On the nutritive spectrum, you can do, again, B vitamins, B6 specifically, probiotics, magnesium, some herbs, passiflora and valerian can help regulate that nervous system. Again, you got to be really careful when you're working with any of that stuff to make sure that it's not going to contraindicate with something you're already doing. Now, food-wise, oatmeal, blueberries, almonds, green leafy veggies, sea salt, high healthy fats. Again, journaling and brainwave entrainment, great ways to manage your anxiety. When we talk about natural therapies for integration, that is never to negate conventional treatments like talk or medication. It is to be done to help replenish, restore, and nourish alongside of your other therapies. Okay, I hope this was a helpful lecture, and stay tuned for another one.